Hi. I'm here to talk to you about diabetes, symptoms, causes and treatments. Diabetes describes a group of metabolic diseases in which the person has high blood glucose either because insulin production is inadequate, or because the body's cells do not respond properly to insulin, or both. Here are some key points about diabetes. Diabetes is a long-term condition that causes high blood sugar levels. In 2013 it was estimated that over 382 million people throughout the world had diabetes. Type 1 diabetes, the body does not produce insulin. Approximately 10% of all diabetes cases are type 1. Type 2 diabetes, the body does not produce enough insulin for proper function. Gestational diabetes, this type affects females during pregnancy. As the risk of cardiovascular disease is much higher for a diabetic, it is crucial that blood pressure and cholesterol levels are monitored regularly. As smoking might have a serious effect on cardiovascular health, diabetics should stop smoking. There are 3 types of diabetes. 1. Type 1 diabetes. The body does not produce insulin. Some people may refer to this type as insulin-dependent diabetes, juvenile diabetes, or early-onset diabetes. People usually develop type 1 diabetes before their 40th year, often in early adulthood or teenage years. Type 1 diabetes is nowhere near as common as type 2 diabetes. Approximately 10% of all diabetes cases are type 1. Patients with type 1 diabetes will need to take insulin injections for the rest of their life. 2. Type 2 diabetes. The body does not produce enough insulin for proper function, or the cells in the body do not react to insulin. Approximately 90% of all cases of diabetes worldwide are type 2. Overweight and obese people have a much higher risk of developing type 2 diabetes compared to those with a healthy body weight. Being overweight, physically inactive and eating the wrong foods all contribute to our risk of developing type 2 diabetes. The risk of developing type 2 diabetes is also greater as we get older. 3. Gestational diabetes. This type affects females during pregnancy. The majority of gestational diabetes patients can control their diabetes with exercise and diet. Undiagnosed or uncontrolled gestational diabetes can raise the risk of complications during childbirth. The baby may be bigger than he/she should be. What is prediabetes? The vast majority of patients with type 2 diabetes initially had prediabetes. Their blood glucose levels were higher than normal, but not high enough to merit a diabetes diagnosis. The cells in the body are becoming resistant to insulin. Studies have indicated that even at the prediabetes stage, some damage to the circulatory system and the heart may already have occurred. Diabetes is a metabolism disorder. Most of what we eat is broken down into glucose. Glucose is a form of sugar in the blood. It is the principal source of fuel for our bodies. When our food is digested, the glucose makes its way into our bloodstream. Our cells use the glucose for energy and growth. However, glucose cannot enter our cells without insulin being present. Insulin makes it possible for our cells to take in the glucose. Insulin is a hormone that is produced by the pancreas. After eating, the pancreas automatically releases an adequate quantity of insulin to move the glucose present in our blood into the cells. As soon as glucose enters the cell's blood, glucose levels drop. A person with diabetes has a condition in which the quantity of glucose in the blood is too elevated. This is because the body either does not produce enough insulin, produces no insulin, or has cells that do not respond properly to the insulin the pancreas produces. Download free ebook in description. How lower blood sugar. Eye complications, glaucoma, cataracts, diabetic retinopathy, and some others. Foot complications, neuropathy, ulcers, and sometimes gangrene, which may require that the foot be amputated. Skin complications. People with diabetes are more susceptible to skin infections and skin disorders. Heart problem, such as ischemic heart disease, when the blood supply to the heart muscle is diminished. Hypertension, common in people with diabetes, which can raise the risk of kidney disease, eye problems, heart attack and stroke. Mental health. Uncontrolled diabetes raises the risk of suffering from depression, anxiety and some other mental disorders. Hearing loss. Diabetes patients have a higher risk of developing hearing problems. Gum disease. There is a much higher prevalence of gum disease among diabetes patients. Gastroparesis. The muscles of the stomach stop working properly. Ketoacidosis, a combination of ketosis and acidosis. Accumulation of ketone bodies and acidity in the blood. Neuropathy. Diabetic neuropathy is a type of nerve damage which can lead to several different problems. Nephropathy. Uncontrolled blood pressure can lead to kidney disease. Stroke. If blood pressure, cholesterol levels, and blood glucose levels are not controlled, the risk of stroke increases significantly. Infections. People with badly controlled diabetes are much more susceptible to infections. Healing of wounds. Cuts and lesions take much longer to heal. For more information, click the link in description. Hope you found it useful. For more information, please click the link in description.